Welcome back to Real Girl Talk Podcast Radio. I am your host, Sherry Ricard. I'm bringing you weekly interviews with fascinating guests, action-packed episodes, highly relatable stories that help women reboot, regroup, and reinvent themselves in family, lifestyle, and business. And of course, always committed to keeping it real. Now let's dive in.
The loss of a loved one is a nearly universal emotional crisis. Unprocessed grief and painful feelings can be buried, leaving you to feel numb. But there is hope. Certified grief counselor, RN, and author Sherry Ricard shares her story of how to cope in her first book, Wake Up Call, A Mother's Grief Journey, after the loss of her 17-year-old son. This book, along with Sherry's other books, are available on Amazon as well as on sherryricard.com.
Today's episode is sponsored by Paperwhite Collections. Paperwhite Collections has the most unique accents and home entertainment pieces to help you get creative. You can shop the look or pick out some accessories and gifts to upstyle staying home. We are all trying to find new ways to spend time in quarantine, and what better time than now than to redecorate. Visit them on Instagram at Paperwhite Collections, and for 20% off of all products, use our exclusive discount code RealGirlTalk at paperwhitecollections.com. Welcome back to Real Girl Talk, and I have an amazing treat for you. I know we're hearing all the time about the coronavirus, and we're listening on the media about what the nurses are going through, what the physicians are going through, but as a nurse myself, I thought it was really important that I bring on two powerful nurses that can really give us some insight about nursing and what's going on, at least in the state of Louisiana, where we are hard hit with the coronavirus. And so I'd like for you to welcome Kelsey Nichols. She is an RN, dog lover, TV personality, and she's best known for the Bravo reality television show, Southern Charm of New Orleans. Kelsey was born with the gift of compassion and the will for helping others, and that basically is what led her to nursing. And over the last few years, Kelsey has connected with a host of like-minded, strong women. Kelsey and I are very good friends. She's very motivated to build businesses, create partnerships, and promote their brands as well. And I also have Ashley Scogin. She is an RN as well. She is a wife to a trauma surgeon. She's a business owner, co-founder of Paperwhite Collections, and her most recent endeavor was becoming a new mommy. Welcome to the show, ladies.
Yay!
Hi,
Hello.
thank you for having us.
Thank you so much. So we're recording here late at night because we want to make sure that this show comes out on Wednesday like I normally do. And normally I have a lot of shows lined up, but I thought it was really important to put some of those shows on the back burner and really talk about what's going on the front lines with the RNs and the RDs and the RTs and the OTs and the STs and everybody in the hospital that is really fighting this battle right now for this crazy global pandemic that we're in. So Ashley, we'll kind of start with you. Tell us a little bit about what you're seeing and what just a day-to-day of what you go through being on the front lines as a nurse right now in one of the largest, if not the largest hospital in the state of Louisiana.
First off, thank you for shedding a little bit of light on this for everybody, because I think it's still just so shocking to everyone. I think that the media tries hard, they try to do a good job with portraying what's really happening in the hospitals, but it's kind of hard because it's changing day to day. The hospitals are filling up. Most of them are almost completely full with COVID positive patients. It's so much so that we're having to move patients that are not infected to other facilities to accommodate rooms for these patients. It's really scary, and those numbers are not slowing down at this point. The hospitals are telling their staff nurses and their staff doctors and everyone that they project even a couple more weeks where this will really be on the upslope before it kind of levels out. So it's pretty scary for everyone.
So
right now.
So what are you doing when you go into the hospital? Tell us a little bit about what the process is, or chain reaction. You come into the hospital for work and you immediately get geared up if you're going to any department that has those COVID-19 patients. So are you getting the gear that you need, your PPE?
The need for PPE is it's been hard. I know that not only in New Orleans and other cities, they're kind of struggling with this as well, because there's just so many personnel coming in the hospital trying to care for these patients appropriately. We're trying to get the PPE that we need. I know that N95 masks specifically are really hard to get. The CDC is kind of changing their guidelines for what they think is appropriate at this time, which, it's kind of a fluid situation. We have to kind of go with their recommendation. But, the hospitals are trying to give their employees the PPE that they need. That doesn't always mean that we have it, though.
Wow. So Kelsey, just tell everybody, for those that don't know, and of course we do as nurses, but people that are not clinicians, they don't understand the difference in the mask. So tell everybody what the difference is between the N95, Kelsey, and then just the regular surgical or paper mask that you see.
Their surgical paper mask is essentially obviously what they wear in surgery, what people might wear if they have a cough, or it's basically going to protect another person from the cough or the cold that I have. We'll just eat right through that mask. I mean, it does protect the healthcare workers or whoever's wearing it, essentially just as kind of a barrier for secretions that I might have. But an N95 mask, you actually have to be fitted for it. We get fitted for them every single year. The purpose of that is to get the proper amount of seal to your face and your nose. And it has like a thicker layer of protection. I'm not quite sure what the material is, but it's a thicker mechanism that protects us from the outside and things that we might have going to the outside, and so that's crucial. So we're in the hospitals caring. We don't have the care of the patient as our responsibility, but you go in and for a fact while you're driving to work that the bare minimum is not provided because there just are none. That alone just sets your day on fire, if you ask me.
It is very scary. And Ashley, I'm just sitting here thinking about you and going into the hospital right now and caring for a patient, and you have hands on where, Kelsey is in a role right now in her nursing career where, yes, she has to be in close proximity to a patient, perhaps, but not really hands-on having to touch that patient and be within that 6-foot distance of that patient. So if you're not getting the equipment that you need and the mask that you need to protect you from that patient, what's going on right now? So what are the numbers in just Louisiana? What have you heard as far as the clinicians actually becoming their own patients at this point? They're becoming COVID-19 patients instead of nurses.
Right. And we are at a point where, COVID has been around long enough that we are now seeing physicians, nurses, frontline healthcare providers that are popping up positive for the disease. So, it is scary because we are coming to that point in time. It is, like Kelsey said, it is scary going into work knowing that you may not have the proper protection that you need to be hands-on with these patients. And a lot of times you just don't. I don't know what the answer is for that. I know the community has done so much to try to provide homemade masks for all the employees in the hospitals and things like that. But the bottom line is that N95 mask is truly the only thing that's going to protect you. And
right.
Have enough, we don't have enough. So.
Right. And, and I see a lot of people out when I go to about the only place that I go is if I have to get, food or some type of necessity for my family. Other than that, I'm working from home like everyone should be, unless you're on the front lines like yourself. And I see them wearing the surgical/paper mask, basically in Walmart and all the different stores. To me, it's better than nothing. But if you are coming within 6 feet of a positive COVID-19 patient or person that you don't even know because they're asymptomatic at this point, the odds of it helping you then are slim to none if they cough going past you, or if they touch you, or basically within that 6 feet. But like you said, right now, we don't even really know. I mean, if they came out with a vaccine tomorrow, I wouldn't personally take it because there is no research, there's no data whatsoever on what the long-term effects are on this vaccine that they rush to the front lines to get done. I'm going to wait for just a little bit while other people take it before I actually subject my children to it, or my granddaughter. I would not recommend anyone taking it until we have proper testing done.
Right, exactly. And, I actually personally have a couple of friends that work at the same hospital Ashley does, have tested positive and have been in quarantine for the last week or so. And my question here, I'm calling and checking on everyone. My question is, what is the treatment for this? What are they? Are we just treating symptoms? Can you catch it again? I mean, I just have all these questions, and really, honestly, they're kind of guessing and the symptoms because they just really don't know that much.
That's true. I never really thought about it. Like if you get COVID-19, you're one of the lucky ones that actually get through it like you would the flu. Have you built up the antibodies and your immune system to where you can fight it off? My guess is no. And the reason why is because if you don't take the flu vaccine, you can get the flu over and over. What's the difference?
Even if you do take the flu vaccine, you can get the flu over and over.
You can get the flu over and over so that tells me that, an immune system is an immune system. You can't necessarily build up antibodies to keep you from catching a cold. You can't build up enough antibodies to keep you from catching the flu. So why would you build up enough antibodies from the coronavirus to be able to fight it off the second go around in a month?
Right. And can we just side note really and talk about how important vaccines are? And we're not saying not to vaccine because everyone should be vaccinated. This specific one, we might want to wait a little longer.
Yeah, I think anytime you're rushing to the finish line to try to rush and get something done, I don't care if it's a medication or if it's just something you're building in your business. Let's just use a business, for example, because we talk about different businesses a lot on my show. If you're rushing to try to get a business going without actually doing your research and doing your proper investment and setting up some type of business plan, you're setting yourself for failure. Well, that's with anything, right? If you rush to the head of the aisle to say I do to someone that you just met 2 weeks ago, what's the preparation? The odds are not good. So it's same with medicine, right? So I would think with a vaccine, yes, I understand they're trying to rush because this horrible virus is they don't know enough about it and it's killing people and it's making them, literally deathly sick to their death in some instances. But what can the vaccine do to you? Just like when my mom had cancer, she never looked like she had cancer until she started chemo. Then she looked like she had cancer. Yeah. So it's like, what's worse? The actual coronavirus and trying to fight it itself, or a possible vaccine that was rushed to the finish line for everybody to start taking?
Yeah. I mean, I definitely think the takeaway from all of this is to take the precautions on the front end so that you're not infected, your family's safe, you're safe, and then you don't have to worry about the rest of it until you're ready and you feel comfortable.
Right. I agree. I mean, just like Kelsey said, I think maybe the fear of the unknown is enough to keep people at home and keep them safe and healthy. At least you would hope so, because there is so much that we don't know. Look at how far it's come so far in just such a quick time.
Right.
We thought, oh, this is only a virus that's infecting the elderly. Oh, it's only infecting the immunocompromised. That's no longer true. Seeing younger people that are dying from COVID-19. And we're seeing, middle-aged people that are in the hospital, intubated, on dialysis. I mean, they're in organ failure. They're very, very sick. So hopefully people are doing the right thing. And because we don't know enough, they're staying home.
I can tell you right now, a lot of people are not staying home. I just going into the grocery store. I understand that you have to get your essential needs. I have to do it as well. I try to get as much as I can in one setting, but also have a 19-year-old that can go through a pantry in no time, So I have to go replenish. However, I have the precautions that I'm taking. I have gloves on and I have a mask on when I go to the store. But I'm walking in a store with people that have no gloves. They have no mask. They are getting within 2 and 3 feet of people in produce to try to get the quickest cantaloupe or lemon over here. And I'm thinking, are you kidding me? Like, there's so many people that are not taking it seriously. And then there are people that, because of their, I'm going to call it selfishness and not taking the precautions, they're putting other people in jeopardy, because I know that what they're thinking, well, I don't have it. I haven't been around anybody that has it. Really? How do you know? Because I just watched you walk in this store with no protection whatsoever. And then you don't know who you were next to. And now you're going to go to another store and then tell me you don't have it because you don't know, right? So what is it, Ashley? Is it 14 days?
14 days. Sometimes 14 days you can go without even having a clue. So, and a lot of people have very minimal symptoms that could kind of look like something else also, maybe
Right.
there's a healthy individual that has a stuffy nose that day and they're feeling a little ill, or, oh, it might be seasonal allergies, but they really might have COVID-19 and just be handling it differently than someone,
Right.
end up in the hospital. So it really is just hard to say, and you just don't know.
So what do the nurses need right now? What can people do to help nurses besides stay home? Because I know that's what you want more than anything, Ashley, is for everybody to stay home, and Kelsey. I know I do. But what can they actively stay home? What can they actively do to help? Is there anything that we can do to help the nurses right now?
That's a tough one because, I think that the community and people really are trying to help every way they can. We've seen like huge outreach from local restaurants, coffee shops, a lot of people bringing things to the hospital to help, at least to make those that are working every day really hard, day and night, to make it a little more comfortable for them. I think that those kind of things are always, they're super uplifting, and it makes us feel supported in the hospital. They may not be able to provide PPE for us, but at least they can, give us
Right.
a bit of
feed you. I mean,
Feed the nurses.
Those things, they feed the soul too. So it's good.
You know what? Food above all, give us food. I know that's all we did on night shift, is if somebody brought us some food, we were super excited. But you know what? That's a great idea, Ashley. I actually hadn't thought about that. Everybody's talking about help, donating so the hospitals can purchase what they need. Let's face it, the hospitals can purchase what they need. It's just, is it readily accessible for them to purchase, number one, because I know a lot of things are on back order. And number two, I see the hospitals pouring tons of money into other things like promotions and all kind of events for their hospital. I know the funds are there, but that doesn't necessarily mean the product is there for them to obtain for their nurses. But I think that's a great idea that, anyone listening, no matter where you are, because we have listeners all across the country and actually many different countries that listen to Real Girl Talk, which I'm so grateful and blessed. You can always just adopt a floor, adopt a department, I know that right now, Ashley and Kelsey are saying, adopt PACU.
Yeah. I'm like, is there another floor in the hospital?
Yes, actually, there is. It's called ICU, which is where I worked.
A very handful of our fellow PACU nurses have been deployed up to the ICUs because we're all critical care nurses. So my heart is now split into, we have PACU nurses and we have the ICU nurses that have had to go up to the COVID floor. So any place in the hospital would be appreciative. And
I think it's wonderful. I think it's a great idea. I think you can adopt a unit. You know what? Call your local donut shop, pastry shop, or, a pizza place, and don't personally deliver it because that's not good for the nurses. We don't want hands-on, but you can have that delivered from a restaurant to a particular floor in the hospital. And I'm glad you gave me that idea because I'm actually going to do that tomorrow. So thank you for empowering me to do that, because I think that's an amazing idea, because if anything, it just lifts spirits and it keeps you guys really going, because 12 hours can be really long, especially when you're stressed out. I know the nurses are scared They're nervous right now. And I appreciate you, Ashley, taking time out of your schedule to just talk to everybody and let just the folks in Louisiana at least know that you're there and you're helping out every shift, long hours, trying to help those patients that are recovering. So we appreciate you. And tell everybody where we can find you on social media.
You can find me at, I am a small business owner too, so that's probably the best place to find me. It's paperwhitecollections.com, and it's at Paperwhite Collections on Instagram. So, check us out.
So paperwhitecollections.com, that's your website?
That is it.
Okay. And do you have a social media platform for your business?
We sure do. We're mostly, we're on Instagram, so you can find us there at Paperwhite Collections.
Excellent. Thank you so much, Ashley. And Kelsey, to everybody where we can find you.
I'm on Instagram at Kelsey Nichols. Come check me out.
Come check her out. And Kelsey she is partnering up with different corporations to do a lot of promotions for their brand. So I appreciate you too, Kelsey, taking time out of your schedule to join us. And all three of us just want to tell all the nurses out there that are listening, we are praying for you. We are behind you. Keep your chin up, because just know that everything that you're doing is in the light, and you're really helping us. We are truly, truly not just saying that we're praying for you. We are praying for you. And guys, until next time, I want you to step out of your comfort zone. Think about something that you can do for someone else this week. And you know what? Pick a nurse, adopt a floor, whatever you can do to help somebody and brighten their days, because they're out there on the front lines fighting to cure your friends, your family, your community right now in the hospital. And until next week, I hope everyone has a blessed day. Today's show, Real Girl Talk, is sponsored by Writer's Roadmap Master Course. This is a course with 9 modules that you will receive 21 lectures packed with valuable information, videos, PDFs, templates, and guides to show you how to write, create a dynamic book cover, format your book, launch it, publish, and of course, market it for free. So when you're just starting out and you know that you want to write a book and you don't know where to go, this is the course for you. It's going to take you from start to finish. And right now, it has just opened for a new enrollment on April 1st, ends on April 10th. And if you use Real Girl Talk 25, you'll get 25% off of this course right now during open enrollment through April 10th. Just go to www.purpose2profits.teachable.com/courses. Again, purpose2profits.teachable.com/courses. Put in Real Girl Talk 25 at checkout to get 25% off while it lasts in open enrollment.